8 foods that may cause itching as an allergic reaction. Although a wide range of conditions can cause your skin to itch, itchy skin is often a common food allergy symptom. Food allergies are typically caused by exposure to specific proteins in foods, which the immune system identifies as invaders and produces antibodies to fight against. Identifying potential allergens in your diet is the best way to avoid adverse symptoms of a food allergy, including itching. Here are 8 foods that can cause itching as an allergic reaction. 1. Soy. Although soy allergies are most common among infants and children, it's estimated that soy allergies may affect up to 0.5% of the general population. This allergy is caused by a reaction to soy protein, which is found in many soy-based products like soybeans, edamame, miso, tofu, and tempeh. Soy allergies can cause several side effects, including atopic dermatitis, which is characterized by itching and inflammation of the skin. It may also cause other adverse health effects, including swelling, tingling of the mouth, stomach pain, and wheezing. Although people with a soy allergy should avoid all soy-based products, some processed ingredients like refined soy oil and soy lecithin, a food additive, can often be safely consumed. 2. Peanuts. Peanut allergies are not only one of the most common food allergies, but also one of the most dangerous. Among those with a peanut allergy, specific proteins found in peanuts can trigger an immune response in the body. Peanut allergies are often characterized by skin rashes and other symptoms like swelling under the skin, wheezing, shortness of breath, and digestive issues. In severe cases, peanut allergies may also cause anaphylaxis, a life-threatening allergic reaction. Research shows that having asthma may increase the risk of severe allergic reactions in people with a peanut allergy. In some cases, highly refined peanut oil may be safe for those with an allergy to peanuts. However, cold-pressed or unrefined peanut oils should be avoided. Those with a peanut allergy should talk with their healthcare provider before adding peanut products to their diet. 3. Shellfish. Shellfish are a type of fish with a hard shell or shell-like exterior, including shrimps, lobsters, squids, crabs, and oysters. Shellfish allergies are usually caused by a type of protein found in shellfish known as tropomyosin. In mild cases, an allergic reaction to shellfish can cause symptoms like hives, skin rashes, and itching. In more severe cases, it can also cause low blood pressure, wheezing, and even anaphylaxis, which can be fatal. While some people with a shellfish allergy experience adverse reactions to all shellfish, others may only need to avoid certain types. 4. Wheat. Wheat is one of the most widely cultivated crops around the globe. It's also one of the most common food allergens, affecting up to 1% of children and adults. Wheat allergies are caused by exposure to the proteins found in wheat, including albumin, gliadin, globulin, and gluten. This can cause issues like itching, digestive distress, and respiratory problems. Some research shows that wheat allergies are more common among those with underlying conditions like asthma, eczema, or seasonal allergies. Those with an allergy to wheat need to avoid all foods that contain wheat, including bread, flour, pasta, crackers, couscous, bulgur, farro, and farina. It's also important to read food labels carefully, as wheat is sometimes also found in products like salad dressings, sauces, soups, and processed meats. 5. Cow's milk. Cow's milk allergy is a problem that's especially prevalent among infants and children. Whey and casein, 2 proteins found in cow's milk, are the 2 most common culprits of allergic reactions. Among those allergic to them, exposure can cause swelling of the lips, tongue, or throat, as well as itching or tingling around the mouth. It may also lead to vomiting, diarrhea, stomach cramps, wheezing, and anaphylaxis. Treatment involves avoiding dairy products and foods that contain cow's milk, including yogurt, cheese, butter, and ice cream. 6. Eggs. Egg allergies are typically caused by specific proteins found in egg whites, including ovalbumin, ovotransferrin, egg white lysozyme, and ovomucin. One of the main symptoms of an egg allergy is hives, which can cause the skin to become itchy, red, and swollen. It may also cause a range of digestive issues, including vomiting, diarrhea, and stomach pain. While some people with an allergy to hen's eggs may be able to enjoy other types of eggs, including duck, goose, or quail eggs, others may need to avoid eggs altogether. For this reason, if you have an egg allergy, it's important to speak with your healthcare provider before including other types of eggs in your diet to prevent negative symptoms. 7. Tree nuts. The The term tree nuts refers to any nut that grows on trees, including almonds, cashews, pecans, pistachios, walnuts, hazelnuts, and Brazil nuts. Tree nut allergies are very common, affecting an estimated 4.9% of the worldwide population. Allergic reactions are caused by the presence of specific proteins in tree nuts, including oleosins, legumin, vicelins, and 2S-albumins. Some of the symptoms caused by an allergic reaction to tree nuts include itchiness, tingling, skin redness, and swelling of the mouth. Other conditions like asthma, eczema, and hay fever may be associated with more severe reactions to tree nuts. Oftentimes, people with a tree nut allergy may only experience an allergic reaction to certain types of tree nuts. However, because of the risk of cross-contamination in food production, it's often recommended to avoid tree nuts altogether if you have an allergy. 8. Fish. Fish allergies are caused by an allergic reaction to finned fish such as tuna, salmon, catfish, and cod. This is typically caused by specific proteins found in fish, including parvalbumins. Among those with a fish allergy, exposure to these proteins can cause symptoms like hives, itching, stomach pain, and congestion. Some people may be allergic to specific types of fish, but not others. Still, those with a fish allergy are usually advised to avoid all fish and fish products due to the risk of cross-contamination. Please like, share, and subscribe. What are cancer symptoms? 10 signs you shouldn't ignore. 1. Mass lump. If you see or feel a new lump or mass that's been there for a few weeks or is growing, get it checked out. Many lumps are not cancer, and your doctor may be able to tell you right away. Sometimes more testing is needed, maybe an ultrasound, CT scan, or MRI. 2. Unexplained weight loss. Most adults do not lose weight without effort. So if you are losing weight without going on a diet or exercise program, talk to your doctor. Weight loss of 10 or more pounds that cannot be explained could be a sign of cancer. Stomach, liver, and pancreas cancers can all cause loss of appetite. Colon cancer can prevent the colon from properly absorbing food and nutrients, causing weight loss. Other cancers can cause mild nausea, which may mean you eat less. But weight loss is not always a sign of cancer. It could be that you have lost your appetite or are skipping meals for other reasons like stress or depression. 3. Pain. Don't ignore pain. If you have new and ongoing discomfort, get it checked out. But bear in mind that many cancers don't hurt. So if you have a lump that hasn't gone away, get it checked out, even if it doesn't hurt. Most breast cancers are not painful, and a growing mass that's not painful is concerning. 4. Change in bowel or bladder habits. This can mean blood in the urine or stool, or changes in the stool. For example, your stool may be pencil thin or black. Any of these could be a sign of colon cancer. For men, urinating more often can be a sign of prostate cancer because it may mean you are not emptying your bladder fully. Having more difficulty urinating also can be a sign of prostate cancer, although more commonly is it because of another less serious condition. For women, unless you're pregnant or drinking more water, urinating more often can be a sign of gynecologic cancers. Take note if you also feel full, have abdominal pain, and experience bloating. Not every urinary symptom is cancer, but if you are concerned or a problem is persistent after treatment, talk to your doctor or seek a second opinion. 5. Fatigue. This is more than feeling tired after a busy day. Ask yourself, does my tiredness limit my activities? If you can't get out of bed to go to work or do something fun with friends, even if you seem to have had enough rest, that's a concern. There are a lot of other diseases that can cause tiredness, though, so fatigue is not the #1 symptom of cancer. Talk to your doctor. 6. A sore that doesn't heal. It doesn't matter where it is. If you have a sore that doesn't heal, it should be checked out. Ulcers on the nipple can be a sign of breast cancer, and of course, sores on the skin that don't heal can be a sign of skin cancer. Inside your mouth, the sore might look like an area that is whiter and doesn't scrape off, or an area that's redder and doesn't go away. Both of those could be signs of oral cancer. Ask your dentist about oral cancer screening. Dentists can look for color changes and can also run their fingers all around your mouth to look for a mass. 7. Change in a mole or wart, or any skin change. Everyone should be aware of how their moles, freckles, and warts look. That way, if anything changes, you can tell your doctor. You can use the ABC guide to track changes in your moles. People at higher risk of skin cancer should get a full-body skin cancer screening from their dermatologist every year. This includes people with fair skin and red hair, more than 50 moles, and people who've been exposed to a lot of sun or tanning beds. If you have a family history of melanoma or a personal history of skin cancer, annual screenings are also recommended. Here is a full list of who is at higher risk of skin cancer. 8. Unusual bleeding or discharge. Seeing fluids where you don't normally see them can be a sign of cancer. If you are a woman, this could be vaginal bleeding or discharge different from what is normal for you. It could also be bloody discharge from the nipple. 9. Indigestion or trouble swallowing. There are some benign throat conditions that can cause problems with swallowing, but indigestion or trouble swallowing also can be a sign of esophageal cancer. If you are having trouble swallowing, perhaps with pills or meat, talk to your doctor. If you've been having indigestion as well, that makes it more of a concern.